You know, for the past several years, we have visited with the folks at Coastal Family Health here in Biloxi and finding out all the great services they provide. And today we decided to come in and get an update. Angel Greer, who is the CEO. How are you?
Good to see you, Jim. Doing great.
It's good to see you again. Give a little background for anyone who's not really familiar with Coastal Family Health. Give us a little background.
We have an interesting history. We started out as a health ministry of the Back Bay Mission in 1975. After 3 years of serving in that capacity, we were at the size and sustainability where we were incorporated in 1978, and that's how we got our new name, Coastal Family Health Center. That wasn't our original name.
Really?
And we started right here in Biloxi. Since that time, we've grown considerably in the last 40 years. Currently, we have 11 community health centers across 5 different counties,
Wow.
9 school-based clinics, and 2 pharmacies.
Tell us what the mission is of Coastal Family Health.
Absolutely. So for our 40 years, we have remained focused and committed to our mission. Our mission is to provide comprehensive quality care to patients in a patient-centered, team-based approach, and we've done that for 40 years.
Wow. Now, you know, we've been here and talked to some of the different folks before. Coastal Family Health is kind of like one of the biggest, the best kept secrets on the coast, because a lot of people don't really know
That's true.
what you do and the services you provide. If you would, tell us about your mission here, or not, but why you're the best kept secret.
So we're a community health center. We receive federal funding from the federal government that allows us to provide our sliding fee discount. You know, a couple of myths that are in place currently is that some people think that we are part of the health department or that we receive all of our funding from the federal government, and we don't. The federal funding that we get only makes up a portion of our budget. The majority of our budget is made up of third-party insurance reimbursement for our services as well as patient payments. So we're not part of the health department. We are a private nonprofit, locally run and governed right here in South Mississippi. Last year, we served 34,000 individuals.
Wow.
And the best kept secret that most folks don't know about Coastal is we have a pharmacy, and we're able to offer discounted prices on our drugs. Same drugs as you would get from, you know, Walmart or CVS, wherever. We can offer that at a discount and apply that same discount program to those prescription costs. Last year, our 2 pharmacies, we filled over 115,000 prescriptions.
Wow.
We offer mail order pharmacy services for patients who live outside of Harrison County or away from the pharmacies that are close by. Interestingly, last month during our when we were looking at our patient satisfaction surveys, there was one patient who mentioned that since they become a patient at Coastal and they're using our pharmacy, that their medication cost per month went from $300 to $29.
Wow.
That's incredible savings.
That's extreme.
And that's available for people who have insurance. Another best kept secret is that even if you have insurance, if you have one of those high deductible plans, you know, most families are not going to meet that deductible unless, you know, they have a major illness or injury. So they can still apply and be eligible for our discount program based on their income and household size alone. So insurance status does not matter when it comes to our sliding fee program. That's another big unknown.
I would definitely say so. That's great. I mean, that just blows my mind. I guess they have to be a patient, though, of Coastal Family Health to get to use your pharmacy.
That's correct.
Okay.
That's correct.
Tell us about your great staff. We have met so many of them. Some of the, especially some of the pediatricians that you have. I'm trying to think of the word of it, just how they work with moms-to-be and then postnatal.
Absolutely. We have a tremendous staff here, Jim. All of us are mission-minded. We are here to give back to the community, to serve the community, and that makes up our patients. And many of our patients are family, friends, people that we go to church with, and so that's what we're here to do. And so every one of our 250 staff members feel the same way I do. And we have been very, very fortunate. As we recruit folks, we're looking for that mission-mindedness. We're looking for board-certified people who want to stay on the cutting edge of innovation and medical practice. And we've been able to do that through our partnership with the National Diabetes and Obesity Research Institute. Through that relationship, Jim, Cleveland Clinic endocrinologists come down to Coastal a couple of times a year. They provide training to our providers to help us manage diabetes and obesity and even hypertension. And so that has been a rewarding experience. I tell you, we've always believed for the last 40 years that what we do, measures up with any private practice provider office or physician office. We've always held that, belief, but we were able to prove that when we submitted our data over the past 2 years into the American College of Cardiology's Pinnacle Registry. So our data on clinical outcomes are benchmarked against private practices, independent group practices, and hospital-based practices across the nation. It is amazing to see the quality of care and the outcomes as a result of our patients being seen here at Coastal.
Wow.
It's pretty good.
That is
pretty good.
What are the different areas that they, as far as medicine and everything, do they work? I mean, I know pediatrics.
Absolutely. So we have pediatrics, we have family practice, we have internal medicine. We've got a Ryan White program that serves all of our patients with HIV. We provide hepatitis C treatment. We have a little bit of services in the way of behavioral health, but not nearly, where it needs to be, and that's just a result of, the environment that we're in. We offer WIC services. We have radiology, ultrasound, women's health, prenatal, mammography, our pharmacy that we've mentioned, dental, and optometry.
Wow.
It's a lot.
That's just about everything that you can cover.
Everything but specialty. We focus all on our comprehensive primary care.
Right.
We want to make sure that the whole person, the whole family is as healthy as they can be.
How about mental health?
Just a little bit. I have a part-time psychiatrist. It's not nearly at the level of what we need, for our patients. I'm recruiting for a psychiatric nurse practitioner. And we are fortunate to have a lot of social workers and counselors, and so they provide patient assessments, intakes, and counseling. But we do need that psychiatric nurse practitioner in order to provide the medication management.
Okay. We have less than a minute left.
Sure.
What would be, if someone wanted to find out if they're eligible, what do they need to do?
They can go to our website. They can call us. And ask the questions.
Is there certain criteria?
Absolutely. It's based on income and household size. Those are the only two things. So with those two pieces of information, we can tell them exactly what level of discount they qualify for.
That's awesome.
Yeah.
And of course, as you mentioned, there are 11 locations throughout the South region here. So best thing to do is go to their website and find out on Facebook as well.
Absolutely. We're on Facebook.
All right. It's good to see you
Good to
again.
see you, Jim.
Always a
Take
pleasure.
care.
Again, if you'd like some more information about it, find out if you're qualified, put in an application, go to their website, you see it on your screen there, or you can also give them a call, numbers on your screen, or go to Facebook and find out more about the services of Coastal Family Health.